Charm Center.
The Charm Center.
The Charm Center.
Charm Center.
Charm Center.
The Charm Center. We want patients to know that there's one place that they can call where they will get directed to the right physician for their problem, who will have experience dealing with their problem, who will be able to get them the right kind of help and treatments that they need. The Charm Center and the administrator helps them through all of that process.
We have 13 Charm associate physicians, so my job is to match the needs of the patient up with the appropriate physician. So from the moment they contact the Charm Center, it's having someone that they can contact with questions or concerns that may come up along the way.
There are many congenital abnormalities or problems that children are born with that often patients or even their physicians, their pediatricians, are not aware that there are new treatments available.
Chris has mild cerebral palsy affecting only his right side, primarily his upper extremities.
I played a lot of soccer and baseball. I did a lot of sports, but I didn't really take any of them seriously. I just did sports every weekend.
Chris's first words were basketball. From there on in, he's tried lots of different sports. And basketball he actually had quite a bit of success with. I think in third grade, he scored the basket that ended the game for the season. Second or third grade, that was really exciting.
I first saw him when he was 14 years old. He had not known for many years that anything could be done to help him use his arm. And he actually got referred to the Charm Center because his teacher had been treated at the Charm Center.
I was underestimating the surgery. I didn't think it would help that much, but after this therapy and recovering, it really did actually help. Even though it was made just a little bit better, a little bit goes a long way.
His thumb isn't constantly subluxing. He can now get his thumb around a ball more easily to pick a ball up from the ground like a tennis ball. He has better range of motion in his right arm. And I noticed that he can now shoot right-handed with his lacrosse stick, which he couldn't before.
In terms of physicians, we have both pediatric orthopedists and hand surgeons. We have hand therapists who are specifically dedicated to the treatment of the upper extremity.
We are not only pediatric therapists, but we're also hand therapists, and so we create a unique blend of the two, and we're really able to offer a specialty to the patients being pediatric hand therapists. And then we can also collaborate with the patient's therapist in the community, so if a patient is following up for their rehabilitation post-surgery, we can talk with their therapist about what is going to be the next best step, what they need to be working on in rehab, and so it really helps to provide the patient with the most optimal care.
We also have on staff research advisors who help to coordinate many of the research projects.
Right now the center has 3 different kinds of research projects we're working on. The first one is clinical research, where we look at the outcomes of different types of treatments, whether it's surgery or injections or physical therapy, to see if they produce the results that the patient and the family and the doctors were looking for. The second kind is the psychological or social needs of the patient. So it's more bigger picture. How is their injury impacting their quality of life? The third is the registry. We meet with every single patient and family that comes in and ask them about their injury or if they have some kind of ongoing long-term issue, and then track things over time to see if injuries are common, how they occurred is common, or if it's something that has similarities throughout the different patients that we're seeing.
We have participated in programs with school nurses where we talk to them about how they can not only prevent injuries in the school setting, but also how to recognize injuries once they occur.
And in addition, when patients come to the Charm Center, they're often given a packet of simple injury prevention ideas that they can undertake on their own. We treat all patients from birth to 20 years of age. We provide all sorts of services in terms of conservative treatment, which often can mean therapy or splinting, to surgical intervention.
I started playing basketball when I was about 9 or 10 years old, and when I was 13, I got recruited to go to St. Anthony's High School in Jersey City.
He always had basketball because he was tall at a very young age, and he was found to be very good at playing ball. So he kind of took being a basketball player for granted.
Albert had injured his hand falling through a plate glass window.
I was playing in my school, and I accidentally, as I was running up the stairs, I tripped.
His finger was literally hanging off. So a friend of mine looked for the 2 top doctors in the field, and Dr. Michelle Carlson was one of the two.
This could have been a career-ending injury. He injured the tendons on the top of his hand, and it would have affected his ability to straighten out his fingers and use his hand constructively.
So at that moment, he realized that he may not be able to play basketball.
And she did surgery that day, like on the spot, because my hand was already like messed up for 3 days, and she didn't want it like to heal the wrong way. So she said that she'll do it today.
From the moment AJ and I walked into the Charm Center, I've never been more comfortable. And they did anything that they had to do to make it happen. They fit him in. They're just phenomenal at helping people out.
He did very well. He returned to his pretty much the same function that he had before he had the injury, except for a few little scars that remind him of what happened.
I actually felt like after surgery, when I started playing, I was shooting better. That's how it felt.
We're trying to improve the patient care from the moment the patient makes a phone call to the center to when they're actually fully treated and leave the center. Patients or their families can reach the Charm Center at 1-888-CHARM-40 or charmcenter@hss.edu.